It's been proven that video games can improve motor skills and spatial awareness. It's the exact reason why the military uses video games to train pilots and soldiers, and many professional racers use video games to improve their driving skills. Improved hand-eye coordination, faster response times, and advanced problem-solving skills can all be attributed to video games. So how can video games help out a CST? Stay tuned. Now, how are video games going to be affecting what the CST does at the field? Very easy. At some point in your career as a CST, an FA, or a resident, you're going to be handling a laparoscopic camera. You are going to be handling possibly laparoscopic suction at some point. Robot surgery, inserting instruments through robotic ports, things like that. And you need to realize that when you are handling those types of laparoscopic instruments and robotic instruments, controls are opposite of what you would think. Up is down, down is up, left is right, right is left. It's something that you need to train your brain to kind of twist and think of when you're inserting things through these laparoscopic or robotic ports. So with that being said, the number one thing I would recommend for anybody looking into assisting at the field, a CST, a resident, anybody that's going to be in surgery, play some video games and go into the control options and invert your controls. So that way your joysticks are set up to be up is down, down is up, left is right, right is left. Once you get that and you play like a certain, first-person shooter game or something like that, and you get used to the controls after about a week of playing a game for maybe 30 minutes to an hour, you don't have to necessarily play every day, but I enjoy video games, and every now and then I'll hop on there, and I've always played with an inverted controller. I don't know why. Maybe it's because I used to like playing like plane games and stuff like that, and flying simulators when I was a kid. But when you train your brain to use those little thumbsticks in an opposite way, up is down, down is up, left is right, right is left, it'll train your brain to think that way. So when you come to the field and you're doing a laparoscopic cholecystectomy with a surgeon and he hands you the camera, you have control. As soon as you put that scope right through that trocar, you are easily able to identify the structures and follow the surgeon as they're dissecting off that gallbladder, and you're positioning the camera and moving with him in like a fluid fashion. You're not constantly looking from right to left, left to right, down, down. It's very easy to get confused when you're handling a camera and you don't understand the invertedness. Something else that can be learned through video games is, like I said before, is that spatial awareness. When you put a scope through a trocar, you have a spatial awareness of everything around you. You're looking through a lens, kind of similar to when you are in a video game and you're basically looking through a lens again. You're looking through a looking glass into another world, but you have awareness of everything around you, whether it's on or off screen. And the same type of thing can happen when you're in surgery and you have a scope in through that trocar. You can see the structures through the lens that you're pointing at, but you're aware of where the abdominal wall is off screen. You're aware of where the liver is. You're aware of where the bowel is down below, small bowel, stuff like that. Those are types of things that you do learn from games and can be translated into the OR as you start handling a camera more and more. So those two types of skills can be learned and brought into the OR just from playing games. Just from playing video games outside of the OR can just be translated immediately into laparoscopic or robotic surgery. Especially even as a surgeon, having that spatial awareness, having that dexterity to be able to maneuver things, just like a small dexterity of using a controller. It can easily be translated into the OR. and it can gain confidence in you yourself as a surgeon, as a resident, a CST, or an FA coming into the OR, and just picking up a camera and knowing exactly where you are inside of a belly or chest. Now, something important to note when using a laparoscopic scope, obviously we have a 0 degree, 30 degree, and arthroscopic surgery uses sometimes 70 degree, I believe it is. And the 30 degree, the higher degree scopes are a little bit more difficult to use. Obviously, they have this bevel at the end. So when you insert this scope in through the trocar, basically wherever the light cord is coming off of, the camera lens is viewing the opposite side. So if I were to insert this in through a trocar, I would be looking at the left side of the abdomen right now. And if I turned the scope, or turn the light cord, now I'm looking at the right side of the abdomen. It's just something that you kind of have to get used to. Video games they don't really help with the higher degree scopes, the 30 and 70 degree scopes. But just always know you're viewing the opposite end of this light cord. So you can easily just maneuver the light cord to look around, and yeah, that's just a learned skill from using it. I can't really help with that. Now, I thought it'd be pretty cool to kind of get a point of view of a surgeon in regards to video games and how it may have helped him or her throughout their career. And here's Dr. Chung. So if you could, just give me some thoughts on how you feel about the techniques that you learn kind of in video gaming and how it translates into the OR, like robotics and laparoscopic.
Yeah, I think the main advantage for people who play video games, and I play a lot myself, is that you're looking at a screen and you're not looking at your hands. Okay, so you have to get used to the idea of paying attention to what's on the screen and having your hands automatically do what you want them to do without looking at your hands. Okay, so that requires a significant amount of practice and familiarity with the instrumentations that you have. Whether or not you're doing a laparoscopic or a thoracoscopic or arthroscopic procedure, you need to know the instruments. You need to anticipate, what they're going to do, while on the screen. You have to understand angles and be able to translate reality in the patient's body to what you're seeing on the screen. Remember, the screen is a 2D object, and the body is obviously a 3D object. So you have to make adjustments in your brain as to what the instruments is going to do, in reality when you're trying to anticipate what they're doing by looking at the screen. The later technology that we have in some cases is we have 3D goggles that allow you to have some degree of depth perception on the screen, so that it makes it a little bit easier, but obviously that's a very specialized set of instruments and equipment that you might not have access to. So it's good to try to get with someone who's very experienced, help them or ask them to help you understand how to better assist when you're doing these minimally invasive approaches. And these things are going to happen, these cases are going to happen more and more frequently as technology improves. So it definitely behooves you, particularly if you're young in your career, to be as used to and as comfortable with those things as much as possible. And that also includes playing a lot of video games. There's studies from the Brigham and Women's that suggest that surgeons that play about a half an hour video games a day have less OR time and less complication rate as well. So I think that it's something worth doing. It's something worth spending time on.
All right, so that's how I feel video games kind of help all these types of people: residents, CSTs, surgeons, FAs in the OR. My mom didn't like me playing video games when I was a kid. That'll rot your brain. No good comes out of video games, blah, 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 blah. As everybody knows nowadays, it's kind of hard to escape video games. It's kind of everywhere. It's on our phones and tablets and systems. It's just everywhere. I have kids of my own, and it's good in moderation. That's what I always say. But just know, for all those moms out there or dads out there that are hating on games, who knows? Your son or daughter might become a world-class robotic surgeon. Don't hate. See you guys in the next video. Bye.